Bismillahirrahmanirrahim. The topic of today's discussion is measles and rubella virus. Usual presentations involve prodromal fever, cough, coryza, conjunctivitis, and then eventually the Koplik spots, bright red spots with blue-white center on the buccal mucosa, followed 1 to 2 days later by the maculopapular rash that starts at the head and neck and spreads downward, lymphadenitis with Warden-Finkeldy giant cells, fused lymphocytes in a background of paracortical hyperplasia. Possible sequel, subacute sclerosing, panencephalitis, SSPE, personality changes, dementia, autoimmune dysfunction, death occurs years later. Encephalitis, 1 in 1,000 persons. Symptoms appear within few days of rash. Giant cell pneumonia, usually rare except in immunocompromised patients. Here's a mnemonic for measles, 4C, cough, coryza, conjunctivitis, and Koplik spots. Vitamin A supplementation can reduce morbidity and mortality from measles, particularly in malnourished children. Pneumonia is the most common cause of death in measles, associated death in children. Now we will revise. First of all, measles has prodromal fever, then cough, coryza, conjunctivitis, eventually Koplik spots, which are on buccal mucosa, that are red spots, bright red spots with blue-white center. White center, red spots on buccal mucosa, these are the Koplik spots which occur in measles. Usually, after Koplik spots, 1 to 2 days later, maculopapular rash occur on the body, which first starts on head and neck and then spreads downwards. Lymphadenitis can occur with Warden-Finkeldy giant cells, which are the fused lymphocytes in the background of paracortical hyperplasia. Lymph node shows paracortical hyperplasia along with fused lymphocytes. Sequel of measles is SSPE, subacute sclerosing panencephalitis, in which the patient has autonomic dysfunction, dementia, personality changes, and eventually death. Encephalitis can occur in 1 in 1,000 persons. Symptoms appear within few days of rash. Giant cell pneumonia can occur, which is usually common in immunocompromised patient. Vitamin A will help to reduce mortality and morbidity of measles. Pneumonia is the most common cause of death in children due to measles. Measles has mnemonic of 4C. It occurs with cough, coryza, conjunctivitis, and Koplik spots on the buccal mucosa.